Hi, good morning, everyone. Thanks for joining. For those of you who don't know me, I'm Dr. Dani Cabral. I'm an Alzheimer's specialist, neurologist, and psychiatrist, and founder of BrainLove. Today, we are talking about an interesting topic, medical marijuana and Alzheimer's and brain aging, what we know, what we don't. I've been in this field for several years and am surprised that I'm sort of seeing the same things on this topic that I have for the last few years, and there hasn't been as much progress as I was hoping in terms of things that would benefit older adults and patients and families. But there certainly is increasing use of marijuana, medical and recreational, by older adults significantly over the last several years with legalization in various states. So it's really important to talk about what the potential benefits are, definitely what the risks could be, and happy to take any questions at any point. So feel free to put those in the chat. I will share my screen now with the slides. All right, so hopefully you can all see my slides. Let me know if you can't. So I'm going to review what we know about how marijuana affects the body and the brain, and particularly as we age and our bodies are aging, how that affects us differently. I will also, it's not listed in here, but I'm going to give an overview of how we have viewed marijuana in terms of culturally and medically or medicinally and from a legal perspective over the years, because I think it's very important if you're a potential consumer or family member or patient that is interested in using this in different ways. It is really helpful to understand that timeline and how things have evolved and what the state is, the status of this now, so that when you're talking to your healthcare professional or you're potentially going into a dispensary, you have a sense of the credibility and the legitimacy of the information you're getting and the products you're getting. I'll explore the evidence for use of marijuana for Alzheimer's disease and highlighting benefits and risks, and then mention some clinical trials and research that are going on in these areas. All right, so just to go over some quick definitions for those who don't know, marijuana is a slang or synonym term for cannabis. Cannabis is the proper name of the marijuana plant, so I'm going to use the word cannabis mostly throughout this presentation. So cannabis has male and female plants, and roughly half of the plants grown from the seed are female, and when not fertilized by males to produce seeds, female plants then bear flowering buds called sensimilla, and this is the part of the plant with the highest delta-9 tetrahydrocannabinol or THC concentration. So I'm sure you've all heard of THC. Now, cannabinoid is a term that describes a category that includes endogenous cannabinoid receptors in the body, their endogenous ligands, so what attaches to them, and then the plant occurring or synthetic molecules that interact with cannabinoid receptors or their ligands. So that's a lot of syllables. But basically, and I'll go more into this in the presentation, but we have this system in the body that the marijuana plant components are acting on called the endocannabinoid system. And we produce cannabinoids in our bodies endogenously. So marijuana plants and derivatives and synthetic marijuanas that are lab derived, that come from pharmaceutical companies, those are cannabinoids that are exogenous to the body and are acting on these same receptors and trying to induce the same kind of positive benefits. And of course, also come with potential side effects. Now, delta-9 THC, that's the primary active cannabis constituent. That's what's giving most of the side effects, the positive and negative effects that we experience. People who are using this will refer to this as THC through the rest of the talk. Now, CBD or cannabidiol is another cannabinoid, and that doesn't have the psychoactive effects like THC does. And so I'll go more into detail, but I just wanted to make sure we were all on the same page with that. Several years ago, when I started learning more about medical marijuana, which was mainly driven by patients, honestly, patients' families, people who are going through dementia and more into the moderate and severe ranges of dementia, and were having side effects of agitation, irritability, severe anxiety, panic. Families would come to me and say, is medical marijuana an option? Several years ago, I didn't know too much about it. And so as I've learned more about this plant, cannabis, it's really complex and there's so much to it. And we know very little, honestly, about how it works in the body, but we do know some. Cannabis, the plant, contains 540 different active compounds. And within this contains at least 125 different cannabinoids. Now, delta THC is the most abundant form of THC in the cannabis plant. And there are other forms of THC. Some of them are quite potent and frankly dangerous and not legal throughout the country to be sold or prescribed. Now, THC has the intoxicating psychoactive effects, the high, and whereas CBD or cannabidiol has the non-intoxicating or more calming effects. There's many modes of administration for this or consumption. This can be inhaled. It can be taken in with oils, concentrates, edibles, tinctures, topically with creams and ointments. And it turns out, you may have heard this, that cannabis is getting more potent over time. There was this looking at between 95 and 2022 of the illegal cannabis products seized by law enforcement, the potency of delta-9 THC had increased from 3.9% potency in 95 to 16.14% in 2022. So that's a profound increase. So really having much more powerful effects on people. Additionally, the cannabis flower and concentrates in dispensaries can have THC concentrations of more than 40%. So it's so important to know that and to be aware of that, especially if you're thinking about older adults who may be using this, and they're going to be more sensitive to these active ingredients. And I'll tell you more shortly about why that is. Another common question that is asked is, what is the difference between indica and sativa? And so now, compared to when I was, talking about this with patients and families years ago, there's a lot more of understanding of this. And this is certainly an oversimplification, and I'm not a marijuana expert, but this at least helps me understand what's happening here. So these are two different plant strains, or now they're called chemovars instead of strains, which I guess is just a messaging change through the marijuana industry, because strains is more synonymous with, say, microbes and pathogens and infections. So they're using chemovars. Indica so these differ by the way the plants look and the leaves. So plants for indica are shorter and bushier with wider leaves. Again, more calming, don't have as much of the psychoactive properties. There's more of the CBD than the THC in the indica plant. I think some people think there's no incorrectly think there's no THC in indica, but there is in fact. But there's certainly more CBD than there is in the sativa plant. So in the sativa plant, these plants are taller with narrower leaves. More, they have the more energizing, more euphoric, more psychoactive properties, and are associated with the high, the enhanced creativity, the focus that can happen, and also with the side effects of anxiety, panic, and psychosis that can happen. And they have much more THC content than the indica plants do. Now, and most of the things people are purchasing now at dispensaries and the lab-derived medications are most often combinations of THC and CBD. I want to just give a quick review of the history of what we know about medical cannabis use throughout human history. So the first reporting of recording was in 2737 BC. Cannabis's therapeutic medicinal properties were first described by Chinese Emperor Shen Nung. And this was for the indications of treatment of malaria, constipation, rheumatic pains, and childbirth, and mixed with wine as a surgical anesthetic. So that's how we did anesthesia back in the day. Into the 18th century, medicinal and religious use continued to be popular with cannabis throughout many parts of the world. And then in 1839 was when cannabis was first introduced to Western medicine by a publication by a physician named O'Shaughnessy, who described its successful use in patients as an anesthetic, appetite stimulant, antiemetic, muscle relaxant, and anticonvulsant. which those reported benefits continue in our consciousness today. Then in 1854, this was entered into the US dispensary. So this was something that physicians could prescribe. Now, moving towards the legal side of it, what happened in, while this was, entered in the mid 1800s, it was being used readily for medicinal purposes. In 1937, Congress passed the Marijuana Tax Act that levied sanctions against the use of marijuana. So this significantly decreased the use, and it became more of a underground drug, street drug. And in 1970, there was tighter restrictions put on it. Congress passes the Controlled Substances Act. It becomes a Schedule I substance. Then in 1984, the War on Drugs period was when Sentencing Reform Act created mandatory minimum sentences for marijuana crimes. And so that's when there was just many individuals, often from lower socioeconomic communities, who were incarcerated for many years for very small amounts of marijuana or more. But in 1996, importantly, this is when California passed Proposition 215, which made medical marijuana legal. So that's been legal for many years now medically. And then moving towards 2012, on the bottom there, Colorado and Washington legalized marijuana recreationally. And of course, throughout those years between those, many states passed for medical marijuana use. They legalized that. And then in 2016, California, the 6th largest economy in the world, legalizes recreational marijuana. So while states have legalized marijuana, many states have, and I'll show you a map of the United States shortly of the states and where they're at with that. Marijuana does federally remain a Schedule I substance under the Controlled Substances Act. So this means what being a Schedule I substance means is that there's a high abuse potential. There's no currently accepted medical use in treatment in the US and a lack of accepted safety for use under medical supervision. Of course, there's been a lot of push to try to lower the schedule, but it remains Schedule I federally. Now here we have by state what's going on with the legalization for medical and recreational, or neither, or if it's decriminalized. So you can see the blue is where legal for recreational and medical. Green is just for medical, not for recreational. And then the gray is no legalization at all. Whereas those that are decriminalized, if law enforcement intervenes and they find some small amount of marijuana in a state where it's not recreationally legal, they will not be incarcerated or punished to the degree that they were in the past. All right, so we're going to shift to talk about what are common medical conditions for cannabis use. How is this, where are we at with that, and how is this affecting our bodies? There's no indication at this point for cannabis to be used as a first-line therapy in our Western medicine setting. So this is considered something as an alternative treatment for vexing conditions where there's chronic issues that aren't being addressed by the current medications that exist, and people continue to suffer and seek other options for treatment that are relatively safe. And so it makes sense that cannabis is considered something that is used for chronic conditions with challenging symptoms. The evidence, the research that's most supportive and most positive for use of cannabis includes chronic neuropathic or cancer pain, spasticity, nausea and vomiting, and weight loss and wasting syndrome associated with chronic and debilitating conditions such as HIV. Now, there's some data, possible efficacy to support use for fibromyalgia, PTSD, certain epilepsies, and irritable bowel or Crohn's disease. How does marijuana work in the body? How does it actually exert any of the effects that people experience, positive or negative? As mentioned before, it works on this endocannabinoid system. Now, so we have this system throughout our body, the endocannabinoid system, and we have cannabinoid 1 or CB1 and cannabinoid 2 or CB2 receptors. There's also, I should point out, there's many other active components of marijuana that we understand much less of how they're acting on the body. So remember at the beginning, I mentioned there's 540 active compounds in marijuana. And so really we focused on by far the most we know about is CB1 receptor, but even CB2 we don't fully understand. And so, and there's many, many other things that we're just starting to learn about. So I'll focus on CB1. Now, the endocannabinoid system is involved in many functions in the body, including pain modulation, inflammation, mood regulation, memory and learning, appetite, and motor control. And endogenous endocannabinoids are produced on demand from lipid precursors and cells throughout the body. You can see on the right where the CB1 receptors are located, really throughout, and there's lots of CB1 receptors in the brain. So if you think about when a person's using marijuana, cannabis in any way, it's very much affecting the brain. And you can see these different areas: learning, memory, cognition, motor, anxiety, depression, appetite, reward, addiction, neuroprotection, neurodevelopment, sleep. Then you can look at these other systems throughout the body. And until I started learning about this because of my patients and families coming in and asking for this, I did not realize what an impact, I did not know much about the endocannabinoid system and how this is different functions and how it's impacting the whole body. And so this is important to think about. And given that there's some data, some disease areas or symptoms better than others of how cannabis and cannabis derivatives are helpful, you can see how they may positively impact these different body systems. Now, cannabis derivatives or cannabis synthetics, so those that are derived in a lab, are acting on the endocannabinoid system and trying to mimic those effects as we talked about earlier. So currently, what marijuana or cannabis related medications are FDA approved? The FDA has approved several synthetic marijuana related drugs that contain individual cannabinoids. So they're lab derived, so they're molecules that mimic the THC or the CBD molecules in the cannabis plant. But no cannabis plant derivative is FDA approved for any medical use. And that's important to point out because what are most people using in the world are the plant derivatives that they're getting from dispensaries or, other ways. And because there are all these active ingredients, there's so much more variability to what people are taking in that it is very difficult to aggregate, summarize, and draw conclusions by, say, surveying people in the world. And even if you surveyed, 100,000 people in the US and got information about their use of cannabis products that they got from dispensaries, it's really hard to draw any conclusions about what actually could be beneficial or harmful because there's such broad variability of what people are getting. And it's not necessarily extremely well regulated. So drugs that have been approved include this drug, Epidiolex, which is a purified form of CBD. So that's for seizures associated with these rare childhood epilepsies called Lennox-Gastaut and Dravet syndrome, which has been really important and helpful for these patients and families, these young, often infants and toddlers who are having nonstop seizures. This has been very helpful and meaningful to their lives. Then we have Marinol and Syndro. So those contain dronabinol, which is a synthetic THC, so a lab-derived THC, and that's been approved for chemotherapy-induced nausea and vomiting and loss of appetite and weight loss in people with HIV and AIDS. And then we have Sesamet, which contains nabilone, which is a synthetic cannabinoid similar to THC, and that's for chemo-induced nausea and vomiting. Now you see on the right, both dronabinol and nabilone are under investigation for agitation in Alzheimer's disease. Early phase 2 trial data are positive and larger studies are needed to confirm that. And from my understanding, these phase 3 trials are completed or close to being completed. So hopefully we'll hear soon about the outcomes of those. Because I'm working with people who have cognitive impairment and they're older, of course, there's a big question of, are there cognitive side effects from cannabis use? Now we know that it's clear that there's, in the short term, immediately during and after cannabis is ingested, there are absolutely cognitive side effects, or can be, for many people, especially when using THC-based products, predominant products. And so that's a wide range of things that can happen in the short term. So attention, focus, memory, learning, to name a few. In terms of chronic use, well, any use, there's clear evidence, this is well established now, that any use in youth and young people has numerous detrimental effects on health, brain health, body health, much higher potential for psychiatric side effects. Sometimes that can be long-term. So things like triggering anxiety, panic disorder, psychosis. I have seen this when I was in my psychiatry residency. I had a young person come into the inpatient unit who seemed to have had a psychotic break triggered by significant marijuana use. So of course we can't be certain that that was the cause, but and maybe that person was vulnerable to that already. But that's certainly something that we all should make sure young people are aware of. Now, there was just a large cross-sectional study published in January of this year looking at people who were 22 to 36, and it appeared that a lifetime history of heavy cannabis use was associated with lower brain activation during a working memory task. Now, that doesn't sound that impressive, but there were 10,000 people that they looked at in this study, and it was pretty clear that there's strong evidence that there's this, for those who are heavy users versus, occasional users, there clearly was this negative impact that was sustained. Now, if we're talking about older adults, specifically those who haven't used cannabis over their lives, and they're just now considering it, as they're hitting their mid-60s and older, there certainly can be these acute cognitive changes that happen, and I will talk about those shortly, the risks of that. Many studies don't specifically highlight or are focused on older adults only, but from what we know so far, there aren't any. There does not seem to be long-term side effects when started in older age, but more data is needed to say that definitively. Here I'm going to talk about what are side effects, risks, and considerations specifically for older adults and the unique things that are happening to us as we age. And including when people have Alzheimer's and related diseases. So the most common side effects for anyone of using cannabis are dizziness, somnolence, drowsiness, fatigue, and dry mouth. And now when you have an older adult with or without cognitive impairment, there can be increased risk of falls and other injuries that can occur when a person is dizzy or drowsy or sleepy. There's some data to suggest that there's cardiac side effects and an increased risk of heart attack with cannabis use, but again, that's inconsistent, but it should just be pointed out. There's in older adults, there's risk of polypharmacy, drug-drug interaction. So cannabis acts on this drug metabolism system, enzymatic system we have in our bodies called the cytochrome P450 system. And so there's all these different enzymes that different drugs either inhibit or induce, and cannabis acts on certain ones of these. And what that can do is it can increase or decrease the metabolism and the availability of other medications an older person is taking, leading to higher or lower levels available. So that can be potentially very dangerous. And if you think about if a person, it's not uncommon for me to see someone taking 10 medications. Like that's pretty standard for someone who's like 75. That's pretty standard in the US. And supplements, right? the supplement industry is huge. So you figure add 5 supplements on, that's 15 medications they're taking basically, and we don't even know what the supplements are doing. So you have all these enzymatic things happening, and it's hard to really know like how these drugs are impacting people and potentially putting them at risk. Pharmacokinetics and pharmacodynamics change as we get older and our bodies change. So basically the metabolism of drugs is changing. We have decreased clearance of medications through our livers and through our kidneys. And also there's typically an increase in fat tissue as we age and decrease in lean muscle. And cannabis loves to hang out in fat tissue. And so it's going to hang out longer in older adults who have on average more fat tissue. Okay. This is the first time I've gone and done another review of what's happening with cannabis use for Alzheimer's and related diseases since a few years ago. And really, there hasn't been much change. As I mentioned at the beginning, when this has come up in conversations with patients and families, it has to do with, well, it's really the families when there are distressing neuropsychiatric symptoms like agitation, anxiety, ruminations, and the medications that have been available. And until recently, there were no FDA approved medications for these neuropsychiatric symptoms in Alzheimer's disease. And we have one now that was approved last year. So families are really struggling, and the medications that are used, some of them, which are antipsychotic medications, carry significant risks, including black box warning of increased heart attack or stroke. And it can be hard for families to consider those medications understandably. And so they're seeking other potentially safer options. Now, there have been studies done over the years on using different types of cannabis compounds and combinations of THC and CBD. Unfortunately, most of the studies are what we call low-quality studies, so they're not rigorous, double-blind, placebo-controlled randomized trials. Often we're left not being sure if that what was given to them in this study that was done actually did what was caused the outcomes, what if they were positive or even negatives. So it's hard to extrapolate and then turn that into good clinical prescribing guidance for healthcare professionals. But it has been suggested that it could be beneficial for different things like agitation, aggression, psychosis, and mood disturbances. There was a 2019 systematic review that found 6 randomized controlled trials, 2 cohort studies, and 4 case series that evaluated safety and effectiveness of cannabinoids in treating BPSD, which is behavioral and psychological symptoms of dementia, or neuropsychiatric symptoms, same thing. And it really didn't bear out that these studies showed strong support for the use of cannabis. So, unfortunately, we're left in this predicament where, I have patients with distressing symptoms, and there's not a lot of good treatments that are safe. And what is a healthcare professional to do? And so I'm discouraged that there hasn't been more progress for good quality education for prescribing, given the just prevalence and easy access to cannabis now through dispensaries. As I mentioned, there are the randomized controlled trials going on for dronabinol and nabilone for agitation in Alzheimer's. So looking forward to those to officially read out. And if I just looked it up and I didn't see any finals on these, but if anyone on this meeting knows anything, I don't know, please let me know. All right, so here's some safety tips. Sorry about the picture there over the words. Here's some safety tips to decrease side effect risk with medical cannabis use in older adults. So this is a synthesis of my knowledge and expertise and anecdotal experience with patients and families and what I have read in the past and recently. And so I would say this is for older adults and especially for people who have Alzheimer's disease and related dementia. So you want to avoid high potency THC products, avoid THC only products. So those are going to carry that highest risk of those psychoactive effects. And any of those could cause small to large detrimental or catastrophic effects to someone's life if they induce severe dizziness, confusion, disorientation, panic, things like that. start with a low dose, titrate slowly, and maintain the minimum effective dose. And so that can be really hard for families in practice to figure that out on their own. Avoid cannabis use concurrently with and I've listed a number of medications, so sedatives or hypnotics, because that's just going to compound the sleepiness that the person's experiencing. Definitely avoid with anticoagulant medications like warfarin. And so remember I mentioned that cytochrome P450 system that affects drug metabolism in different ways. So there's case studies that show that CBD increases warfarin levels, blood levels, and thereby increases the risk of bleeding. So warfarin is a heavy duty blood thinner that's also known as Coumadin. So definitely want to avoid cannabis use completely in someone who's taking warfarin. We have, I would say, avoid with antihypertensives. You could have unexpected drops in blood pressure, and that could lead to a variety of negative effects. But in the very short term, a person could suddenly feel like they want to pass out. They become off balance. They're not getting the blood flow to their brain, and they could fall. Or they could pass out. Anti-seizure medications, pain medications, and antidepressants and anti-anxiety medications. So the pain and medications in the last two, so those are more that the addition of cannabis could compound or magnify the effects of those, which could ultimately be problematic. And then finally, recommend avoiding driving for an older adult, really anybody, but definitely for older adults who are using cannabis. There are observational studies that show that driving is negatively impacted by cannabis use. I just wanted to mention the challenges and barriers to medical cannabis prescribing for healthcare professionals. And this is that when I said it was discouraging, this is where I'm pretty discouraged that this is still where we're at. But this is really important for you to know if you're considering this for your family member or yourself for medical reasons. So it's profoundly challenging to get high quality, trusted, credible guidance and education as a healthcare professional. So when I go seek out medical education for a variety of things, I can go to the professional societies that I belong to, and I can sign up for continuing medical education and feel confident that I'm getting high quality, evidence-based information that's going to give me often specific prescribing guidance and things like that. But that doesn't exist with medical cannabis. There's many reasons for that, but it's really frustrating because when you're in an area of medicine that you have patients and families who are really suffering and you really want to help, and there's this thing that could potentially help, but it seems elusive to be able to get your patient and family to the right compound and take it correctly and trust like the dispensary and the people they're interacting with are going to give good information. And I often do picture like some 21-year-old who's like confidently saying like, yeah, this is going to help you do this and this and do this and this. And I don't think they're really aware of the person and their medical issues and medications and like the things we talked about earlier about how things changed with older adults and their bodies and drug metabolisms. So what happens is a lot of healthcare professionals just say, I'm not even going there. I'm not going to bother. I don't have time. And there's huge risks to prescribing these things and giving guidance because if something happens, if someone gets hurt, if there's an adverse event, your license is on the line. And so with how busy we are as healthcare professionals, it's easier just to say, I'm not going to even give guidance on that. Now there's few high quality, rigorous studies. Studies inconsistently report adverse effects. Negative studies are often not even published. So there's this trial done using some kind of medical marijuana. It ends up being negative. It doesn't help. It doesn't get published. We don't know. No one knows. So that's challenging. And there's so many products out there that it can be very confusing. There's a lack of standardized dosing, lack of established guidelines. And then in terms of research challenges, now as a clinical researcher, so I've been involved in clinical trials for many years and was involved in one study trial using a combination of THC and CBD for individuals with Alzheimer's related agitation at end of life who were on hospice. So I was a part of the study startup at my site for this. And it was incredible how much more complex it was to get this study going than any other trial we'd done, because it's a Schedule I substance. There are so many additional regulatory, operational, and safety requirements. There's so many different federal and local departments and bodies that need to sign off on what you're doing, and you need to do this all in a certain order. This is a disservice at this point to patients and families that this is my opinion, but Schedule I substance, that we can't decrease that schedule so that we can have easier access to conducting higher quality trials to help guide our healthcare professionals and help our patients and families. So that is it. Thank you. Feel free to email me at any time. If you have a topic you'd like to discuss on this, I would love to hear about it. All right. Well, thank you, everyone. Have a great day. We'll catch you next time.